Our smiles are our biggest asset, and that's why you and I, all of us, need to take care of our smiles quite well. That's why today we are in conversation with someone very, very special. So let's start our conversation.
Thank you, Ms. Bani. I'm Dr. Abdul Rahman, working as a dental surgeon, Nasim Medical Center, Al Hilal branch. I'm practicing since 1998, almost 25 years of experience in dentistry.
And that's perfect. So you have so much of experience. I feel like if you can get even a single drop of it to understand our oral hygiene and our own oral health better, it would be amazing. So can we begin with this question? What does a good, healthy oral hygiene look like?
To maintain a good oral hygiene, we need to practice brushing minimum 2 times, one in the morning and one before sleep. And also, we have to do the flossing once daily. Flossing will help you to remove all the food particles between the tooth where the brushes cannot reach always. Okay, and also after the food, we need to give some time for brushing, at least half an hour to 1 hour. If you wait, it will help you to maintain the good health of the tooth, because immediately after the food it might cause the formation of an acidic medium because of the secretion of the acidic juices from the stomach. Okay, so that will cause if you do the brushing immediately, that will cause wearing of the enamel and cause sensitivity. So these things has to be taken care of.
Okay, moving on to our second question. How often should one visit a dentist, go for a dental exam or for a cleaning?
The dental visit, at least you should visit once in 6 months. That will be always better, because if you look at the dental cases, regarding other medical problems, you will have to visit when you have some complaints. But regarding the dental cases, you should visit the dentist without any issues, because you can find out the things at the initial stages, and if you treat in that stage, it will be good to maintain the health of the tooth.
How often can someone use a teeth whitener or in-home whitening treatments?
If you are doing the in-home whitening, you should always take an opinion from the doctor, because sometimes it causes problems for you. If you keep it for a long time and all, it can cause damage to your gum and the tooth. And once in 2 years or 3 years, it's okay for doing the whitening.
How can one prevent tooth decay, gingivitis and other problems?
To understand this, we should know the tooth structure. We have 3 layers of the tooth. The outermost layer is called enamel, and the second one is just below that is called dentin, and below that is called pulp. When the caries start developing at the outermost cover, when it forms in the enamel, it is safe to do the filling. We will not have any feelings or any discomfort when the caries or decays in enamel. So when you visit the dentist, he can tell you that you have a decay here because of the color difference, or you can see when you watch in the mirror, you can see in that and you can find out. So that will help you to fill at the earliest stage. If you don't visit the dentist, it will go deep into the dentin. It might cause sensitivity. So that time you may have problems for taking hot and cold things. So you will definitely visit the dentist and do the filling. In that stage also, if you neglect it, it can go more deep into the pulp and it can cause severe pain that might lead to the root canal treatment. So once you go for the root canal treatment, your tooth will become more weak. So try not to reach at that stage, and if you visit the dentist regularly, and you can prevent all these complications.
Yes. Can you, now that we're talking about it, can you explain a little bit more what is a root canal and how can we avoid going for a root canal?
Okay, as I told you about the 3 layers of the tooth, enamel, dentin and pulp. Enamel and dentin, when the decay is in enamel dentin, you can safely do it. When it goes to the pulp, that is the blood vessels and nerve endings, so it starts giving you pain. If you fill on top of it without removing the nerve, it will cause more pain in the future. So what we do is, we remove the nerve tissue, blood vessels and nerve tissues from the root and the pulp chamber, and if there is a gap forming in that area, we clean it and shape it and fill the root and the pulp chamber of the tooth. So that is called root canal treatment. So ultimately the tooth will become dead.
Right.
So tooth is brittle and the chances to break it, so you have to give a cap also for that to protect the breakage.
So how can we avoid going for a root canal? How can we be safer?
This can be avoided by regular visit and visit and checkup and treatment. If you do the proper treatment at the early stages, you can avoid root canal treatment. So detect the lesions early and treat early.
Right.
That's the best.
Of course. A lot of people, in fact a lot of my friends too, report of tooth sensitivity. So what is tooth sensitivity and what are the symptoms that it might be a symptom of something bigger that you need to visit a dentist or a doctor?
Okay, most of the people complain about the sensitivity. This can happen because of the wrong brushing technique. If you do the brushing in a horizontal way, the straight way, you are rubbing against the enamel rods and the tooth become worn off. So that causes sensitivity because the outermost cover is the enamel. Enamel is not sensitive, like it can prevent everything, hot and cold, everything it can prevent. But when the enamel worn off and when it reaches to the second layer of the dentin, it causes sensitivity. So when you take hot and cold things, it causes sensitivity. So to protect that, proper way of technique you should know, proper way of brushing technique you should know. Then if you have some other habits like grinding habits while sleeping, you may not know it sometimes, but some people have the grinding of teeth while sleeping. So that can also cause aberration of the tooth or warning of the tooth. So it can cause sensitivity. These are the different things and also when there is a decay, because with just a color difference, it does not cause any sensitivity. So when the teeth damages and there's a cavity forms, so that's also cause sensitivity and pain later.
Alright, we're talking about infants and children who are very young. What causes tooth damages in infants and what is the first time that someone should focus on a child's dental care or take them to a dentist?
See, in this case, the baby's teeth has to be taken very much care because most of the people neglect it. So they don't know how to brush this. So what you can do is that initial times you can use with a gauze piece and clean it with single tooth also. You can clean it with a gauze piece, or you can use a finger brush. So this will before reaching 2 years. So you can do all these kind of things and clean it properly. And after 2 years, you can use brush, no problem. Okay, so whatever is your convenience, even finger brush will be most helpful to clean it because infants also they will not have much issues with that. So easily you can do it. And another thing you should take care about this is the bottle feeding. So most of the times, what we do is that when we'll give the milk through the bottles and kids they sleep off with that. So that can cause one type of caries called rampant caries. So you can see most of the front tooth is completely decayed. So this also can be prevented by giving after bottle feed, immediately before going to sleep, you can put another bottle of water also to clean it properly. So that way you can protect the damage of the front tooth.
Okay, thank you so much for having a conversation with us, sir. I feel like there's a lot of information that I've not only taken for myself but also sort of fed in my brain to distribute it to all my friends and family. No, I know this is right what you need to follow. Thank you so much. Is there any final message that you would like to give to all our listeners, to all our audience regarding tooth care and dental care, like one big takeaway?
My message is that if you do the regular checkup, you can find out the lesions at the earliest stages. This will help you to protect the tooth by giving the treatment at the right time.
Thank you so much, sir. I am so thankful that you came here, you had this conversation with us, and thank you so much for all the great work you do for people. Thank you so much. Alright, keep watching and stay tuned to our 106.3 FM frequency and to our social media pages. Jiyo Bindas.